of the misgivings that I was told about the vaccine was that it's very possible for you to get COVID from taking the vaccine. After doing more research, I learned that wasn't true. But I think that there are still a lot of people who believe that. And I think that there's also many other conspiracy theories around the vaccine as well. But I think that doing the research for yourself, reading and being confident in what you're reading and who you're reading it from is going to put you at ease a little bit more, just because a published material that is from a trustworthy source is going to be the most useful to you at this point.
In January, I got my first shot of the Moderna vaccine, and I can't really describe the level of gratitude that I have for even having a spot.
I want to get the vaccine because I want to know, for my own peace of mind and for my own safety, that I did everything possible to either slow the spread to my friends and family or to keep myself safe.
I have no concerns. I get my shots, my kids get their shots. I'm gonna get my COVID shot when it is available to me.
I don't know, like I've got a 2.5-year-old, and we just had to go through all of their childhood vaccinations, and we talked with them about how it's going to help them develop a superpower, how it's going to help them be immune to certain diseases, and it's going to help them make sure that they don't get any of their friends sick, and that they're effectively becoming a superhero who's going to protect their friends and community. And you know, that's what I said to my kid, and it stuck with me.
I urge medical providers to be sensitive to historical inequity and current inequity in the medical system, medical care, and related fields suffered by the trans community and by trans people of color in particular.
The weight lifted off of my shoulders for the mere fact that the work that I do every day in community could expose my family and the parents that I care for to COVID-19.
3 COVID vaccines have now been approved by the FDA. Johnson & Johnson, otherwise known as Janssen, Pfizer, and Moderna vaccines. These vaccines have gone through clinical trials with almost 100,000 volunteers around the world.
The vaccine is not known to interact with hormone replacement therapy medications, but you should talk to your doctor.
The vaccine is free to the public, regardless of whether you have insurance.
Get the vaccine as soon as you become eligible, and encourage your friends and family to do the same.
Many trans people have difficulty with healthcare settings due to discrimination, historical trauma, and medical racism.
To make the process easier, consider bringing a trusted friend and know your rights.
You can say no, slow down, or I need a moment.
Be prepared to be at the clinic for at least 30 minutes, as all patients have to be monitored for 15 minutes after getting the vaccine.
If you get anxious in healthcare settings,
Bring a toy or plan an activity to occupy you while you wait.